I hear it's Christmas time, and one of the things that we forget about, I guess a lot of our clients forget about sometimes too, is about parasite control and heartworm prevention. It's called all year for all year, and during the colder months we have a tendency to say, well, there's no mosquitoes and there's no parasites. But the real truth is that fleas love to go indoors just as much as we do during the wintertime. Parasites become dormant and not as active until the weather warms up. Mosquitoes, they'll have a hatch. You'll have a hatch of mosquitoes. All we have to do is have a couple of days at mid 60s to upper 60s and low 70s, and we'll have a mosquito hatch, and we have spread heartworms once again. One thing I want to the primary thing I want to talk about today is real simple. The two basic types of flea and heartworm control. We have topical, which is applied directly to the skin, and we have oral. Below us we have a listing of what we use here in our clinic. These are the products, both topical and oral, that we do use. But I left this out here just to illustrate how many different types and how many different uses of products there are for flea, tick, and heartworm prevention. And if I remember correctly, there's about 5 pages here. So trying to decide which is best for you depends on whether you like products that are oral or like products that are topical. We have today Miss Hannah. Hannah is one of our favorite dogs that comes in, and she's a sweetheart. We're going to show the primary way to apply topical heartworm and flea control prevention. We want to make sure that we, frankly, separate the hair, get down to the bare skin, take the flea or tick control or the topical preparations, apply it directly to the skin, and then let the hair go. The biggest problem that we see is that people take it and they apply it all along the back of the dog. When you do that, you're just medicating the hair.
Also, when you're applying a topical product to a cat or a feline, you want to apply it to the base of the skull, and not behind the shoulder blades, because cats can actually reach behind the shoulder blades. So that's why you would like to take your product behind the base of the skull, part the hair down to the skin, and voila.
We've seen the topical application. Just remember that oral is very straightforward. Most of these products are in treat form. They can be given by mouth. The key here is make sure that your dogs and your cats are well protected every single month all year round.